The question about whether payer policies are impacting the use of immunotherapy at this point in time is probably not. I think most payers, Aetna for example, has decided that they are going to respect the judgment of the FDA, CMS, and most importantly at this point, NCCN. And so if NCCN says the immunotherapy is worth doing, we by and large pay for it. That's not to say that we don't regulate the use. We do. And I think because the therapies are very expensive, the traditional managed care approach is to prior auth, pre-cert these therapies. Those policies are in fact in place for the very expensive immunotherapies, and they are pretty strict to labeled indication. So for example, patients with prostate cancer and sipalucil have to be minimally symptomatic and not have visceral metastases. That's the label. Now, what's going to happen in the future? Well, that's a much harder question, because as healthcare reform occurs, I think we're going to see shift of responsibility for cost to providers who are going to have stake in the game, and maybe to patients, because there's all this talk about value-based insurance and reference pricing and things like that. So I think the idea that the entire locus of control is going to be the payer, probably not true in the long run.